mind and introduce yourself to the rest of the participants.
Good idea.
Somebody has to start first. Can I ask Valerie to start?
So funny, I had a feeling you'd do that, Louis. I am Valerie Fox. People know me as a co-founder of the DMZ in Toronto, and now I actually help grow incubators and accelerators around the world. Really great to be here and just very excited about the new innovations that I'm hearing about.
Okay, so I did just get word that we are live now.
Super.
So thank you for that.
Thank you, Valerie.
Okay, so I mean, it was a we are live, I think, so I'm hoping we are in fact live, but I'll let someone flag me down. But we're going to be repetitive again anyways, and just I think all the messages we've shared already that the rest of the audience would want to hear. So I do apologize to those who are on this call who've been having to listen to us, but Mary, I'll let you take it away to start.
Hello, everyone, and welcome to the final pitches for the Techstars Startup Weekend. Unite to fight COVID-19 Canada. This weekend has been an amazing event, and we've had a unified theme. So we've seen teams coming together to come up with venture ideas to address the challenges associated with COVID. We've had an amazing team of organizers coast to coast that have pulled this together in less than a month, and in particular the last 2 weeks, which has been an amazing volunteer effort from organizers. The Techstars online weekend has taken the best of the in-person experience in Startup Weekend, you could say, and put it online. So we're part of a global initiative, over 70 countries taking part of this initiative. And we've, it's unprecedented in that it's 100% online, and it's taking advantage of technology, allowing teams to meet with mentors in various rooms and have the same experience as they would, or close to it, as close as we can to an in-person Startup Weekend. This has been the first time that we've hosted a national online Startup Weekend. And in fact, it may be a once in a lifetime experience.
Awesome, thanks, Mary. So yeah, I just wanted to share a little bit about how the teams actually came together, because it's very different as to what would normally happen at a Startup Weekend. So we had 76 ideas submitted from participants in advance of the weekend, which was really cool to see. Typically on a Startup Weekend, you would have the opportunity to pitch on Friday night. A lot of people do it on the fly. So having to kind of, form your pitch and share that in advance was unique. So 76 ideas formed to 25 teams. And essentially from there, we were able to, when people were forming their teams, they were actually doing that all virtually, obviously, as well. And I think it's worth saying that it takes a lot of bravery to reach out to team leads and, post about your skill set and your background and kind of what you can bring to the table before those teams are actually put together. So that's something that's super important to keep in mind as to how these teams have actually come together. So it all happened through Discord, through submitting ideas in advance. The team leads were able to submit a 60-second video, and that was basically it. So that's what brings us to where we are now. And tonight, right now, we're about to hear from the top 10 teams. So they've all joined us here on the call. But before we get going, I do just want to also acknowledge all of the work that the Techstars team has done. So this is just a photo of the CEO, David Brown, and we have a welcome message from him coming up shortly. But before I get to that, I also want to say a shout out to our Techstars leads, Stephen and Carissa. They have been working on Overdrive, as there's over 70 events happening around the world in April. It's amazing. Yeah, little round of applause for them. Seriously, I don't know how they're doing it, managing multiple events across so many different time zones. I know for a fact that they're each managing multiple groups, which is incredible. And it's, you know, it's a global effort across the board. So huge, huge, huge thank you to them. And also thank you to all the people behind the scenes who have been putting together all of the resources that we've been using all weekend. For those who aren't really familiar with Startup Weekend, Techstars does an amazing job of just packaging everything that we would need to put this on, while also giving us the space to shape the event in the way that we'd like to see it come together. So without further ado, I'll share that message from David Brown.
Hello again, David Brown here, calling you from my home in Boulder, Colorado, where I've been holed up for the last few weeks. Hope all of you had an amazing experience and came up with some really incredible ideas. I have no doubt that you did. Speaking on behalf of the entire Techstars network, I wanted to thank you. Your work and your passion are very appreciated. I really believe entrepreneurs are more important today than ever before. We have this experience from running startup weekends in person. We typically, if there is such a thing as typical anymore, we typically run them in 1,000 different locations every year all around the world. Hopefully you'll be able to join us in one of those when things get back to normal. Meanwhile, we also have dozens of accelerator programs. Today I'm wearing a t-shirt from our accelerator in Indianapolis. We connected with us. Please feel free to check out www.techstars.com. We have a lot of content there for entrepreneurs, especially a lot of content related to surviving in light of COVID-19. Thank you again. I can't thank you enough for working so hard over the course of the weekend to solve this really, really important problem. I'm excited to see what solutions you've come up with and how they'll change the world. Stay safe out there and keep working hard. Goodbye, everybody.
Awesome. We'll say thank you to him for that message. That was great. Oh, and we're going to play it again, apparently. No. Okay, I'm just going to pass it off to Mary now to give an overview of the judging criteria as well as the judging process.
Thank you, Danielle. We're now reviewing the judging criteria just so that it's fresh in everyone's mind. We're about to see the final 10 teams pitching from the first round of the challenge. And so sort of jumping into the process, sharing a little bit about the process on the next slide. The round one is now completed. And the judges have narrowed down our 10 teams to pitch. After the judges will deliberate and then select the top 3 that will be announced during the closing ceremonies at 6 o'clock Eastern Standard Time in a separate YouTube live link, which we'll be sharing with you on a later slide. So for the teams, this link has been posted and pinned to the announcements channel and the Ask Me Anything channels on Discord. So the teams, we don't have a picture of everyone that participated, but Danielle will give you a rundown of the numbers of the people that we had over 450 participants in the program that registered. We had some 200 odd that ended up participating, ending in over 25 teams that formed. They've had an amazing weekend. We've had 26 judges from across Canada, and you can see the photos of the judges. Their bios can be found on our community page at our Techstars Startup Weekend, where you can follow their social channels as well. They've taken the time to review all the pitch videos selected and selected the top 10 teams. And they will also be participating in Q&A during this session. So a shout out to celebrity judges, Major Laser and Hannibal. So we're super pumped about the judges participation. And so a big round of applause virtually for the judges. Thank you very much.
We can still clap. That's allowed. Awesome.
So the judging criteria teams will be judged using 5 criteria. The criteria was shared with the teams at the beginning of the weekend. So they have folded each of these criteria into the work that they've done and into their pitches. And we'll briefly review each of these criteria with you now. So the first criteria, problem and impact. So first and foremost, the teams had to show that they're solving a real problem and that the problem is related to COVID-19. So judges will be looking at teams tackling problems related to COVID-19. And you'll notice here in the slide that the problem is really related to the value proposition. So have they done some work to validate that this is a problem and for whom? They've identified the customer segment. And although it took place on the weekend and it's very difficult to reach out and find oftentimes the customers that they had to, they made great efforts to do so. And so in talking to potential customers, then did they validate that this was a problem for the customers? And in doing so, that also helped them identify the opportunity. And so the more they could understand that problem, how big it is and how many people it affects, how big the market is, then it helped them, they use that as a starting point to develop the product or the service that they were working on. Execution and design. So one of the things that teams worked on throughout the weekend was their minimum viable product. And so the minimum viable product, we were meaning a minimum set of features that would allow them to start collecting data and to test. And that minimum viable product evolved over the weekend. So they should be able to use that minimum viable product to convey the type of product that they're working on, how it works, who will it impact, and they used an early version of that minimum viable product to gather data, but that minimum viable product should also, it could be as simple as a diagram or a schematic. So we know that they do not have to have a functioning product at the end of this weekend, nor are they expected to. So in many cases, they may have used a wireframe to help you understand what a website or an app might look like. And it should be quite clear how that product will work. What are the features? What features will it have? And that helps them separate themselves in the market from their competitors as well. So originality, Startup Weekend is about building something from the ground up, and the solutions must be original. So these can be brand new solutions, or they could apply existing solutions in a new and innovative way. So, so this is part of the innovation piece, an innovative solution. So the novelty must be present, and their idea cannot be something in total that already exists. And so that means that it cannot be a solution that they have already built prior to coming into Startup Weekend. And so this has been something that it also helps them separate themselves from what already exists in the market. And feasibility, it must be something that is either technically, scientifically feasible. Can it be built? Can it be launched within a few months? Is it realistic in terms of the legal or scientific aspects? Also, does it require years of testing or clinical trials, such as a new drug or a medical solution, then this is not feasible within the time frame. It should be possible to build and launch the product within a reasonable time, but you'll note that there is an exception. Exceptions may be made for particularly impactful solutions that will make a huge difference or potentially impact a lot of people with a longer term perspective and impact. And teams were also asked to look at other impediments that might be there. Are there safety standards? Are there privacy issues? And so by addressing those, it also helps identify whether or not the product is feasible. And the business model. So business ventures coming out of Startup Weekend must be couched in a sound business model. And this means that it must have a clearly defined customers with a clearly defined value proposition. They should be able to explain how they're going to make money. What's the plan for onboarding customers and rolling it out? What is their go-to-market strategy? This is different than simply building an app with no revenue stream associated with it. And they also have to be thinking about the cost and potentially key partners and what kind of resources will they need and what are their activities. And did they validate that business model? That's part of this validation. Part of having a viable business model. Was there an effort made by teams to validate the business model by talking to potential customers, partners, channel partners, etc.?
Awesome. So I just want to make a quick note that you might notice if you're in the Zoom call that the chat is disabled, just so we can keep the pitch order top priority. So if you do have any questions in the call, please raise your hand. If you're a team member and you have more of a logistics related question, please use the Ask Me Anything channel in Discord as per usual. And with that, I do want to just say a huge thank you to the global partners. So these partners were all recruited by Techstars to provide resources to the teams throughout the weekend, and not only during the weekend, but beyond. So we know that going through something like this is such a great experience, and you kind of need a soft landing afterwards of things that can help you continue the momentum that you build during this time. So just wanted to recognize those partners. And we also want to send a huge thank you to our national partners. So as I mentioned earlier, these partners were all recruited by members of the organizing team and some are our volunteers. So basically, these partners all have the same mission of supporting small businesses and startups across the country, whether it's students, entrepreneurs. There was really an amazing group of resources that they provide. So if you visit the community page for this event, all of their logos are linked there, so you can go and check out their website and figure out what they're doing to support and how you can get involved. I'd also say that they've really helped us get representation from as many communities across the country as possible. And it really we wouldn't have been able to do it without this group of partners. So we had over 55 people who were spreading the word, which is super cool. So those are some of our partners. This is, of course, the next slide, including more. So everything from our Startup Canada chapters, Startup Grind chapters, post-secondaries, accelerators, and more. So big thanks to you guys. And we wanted to give an overview of what's kind of next. So we're about to see 10 pitches. What are they winning? What does that look like? We know it's not about winning, all about winning, but the prizes are always some really cool incentives, particularly this Techstars Global Prize. So essentially what will happen with Techstars Global is the first place winner from each country will move on to a global finals round with Techstars. And then 20 companies or teams from that final round will be selected to go through a Techstars Innovation Bootcamp. And then from there, those top 5 bootcamp graduates will receive a $10,000 grant from Differential Ventures. So super cool incentive to be a part of a global group of teams. So good luck to that first place team. And next, we do have tons of really amazing local prizes. So again, lots of our partners have come forward to support with that. So the winning teams will be getting everything from conference tickets to access to virtual accelerator programs, access to co-working, of course, once this is all over, as well as services from legal support to web development and everything in between. So we really appreciate all of those contributions as well. So now the moment you have all been waiting for. So, yeah, finally we're here. So I'll just go through a few of the logistics, and then Mary will step in and share them as well. So basically, for participants, I just ask that if you're not presenting, please turn off your video, just so it's easy for Mary and I to identify the judges and whether they have questions. Again, after 3 minutes, you will be muted. That will be the end of your presentation. You have 30 seconds to queue up those slides. And if not, we will be ready to play your video. And now I'll let Mary step in with the rest of the logistics.
So we'll also, as Danielle mentioned, the 3 minute is a hard deadline. And also we have 2 minutes for judges Q&A, and we're going to let judges raise their hand if they have a question, and judges will rotate through the 2 minutes, take turns asking questions. Danielle and I will try to flag you when you raise your hand and make sure that everybody gets a chance to ask questions. And once we're asking teams that once the Q&A period has ended, if you could please leave the call, and you can continue to watch on YouTube live stream. Judges will remain unmuted, and I guess now, if there's nothing else, drum roll, we can announce the 10 top teams.
It's almonds in a jar, but that's it. There we go. Cool. Okay, so first up, we have 16-bit Cortex. So I'm just going to stop my sharing and you can queue yourself up. Oh, well, sorry, that's, oh my gosh. Okay, so sorry, we're following a different order. That's my bad. I guess it was updated and not updated in our deck yet. So Piggyback is actually first with Benjamin.
Okay, I'm going to assume you guys can hear me.
Yep.
COVID. The slide is not moving.
And
Okay.
I'm
going to restart.
Danielle, I'll put the 3 minute, is this helpful to put the 3 minute timer up?
Sure.
Okay. COVID-19 has resulted in social isolation and social distancing for many elderly people who now are have limited access to essential things like groceries. At the same time, many of us are now stuck in our apartment buildings, wondering why there's such a lack of community, since we're realizing that we don't know anything about the people around us. There's clearly a demand for people to want to do good in their community and to help out in this time of crisis, but there's not many tools for us to know how, who to ask, or where we can start. Piggyback is a solution for people to buy groceries for their neighbors, so that they can save a trip to the grocery store and they can do a good deed. In our user research, we found that 81% of our users would be willing to pick up a small grocery item for free if they were asked by a neighbor. Here are two of the people that we spoke to. Take Mike and Sue, who live in the same apartment building. They're both members of Piggyback, and Sue has a situation. She is baking a cake but has no more butter, so she goes on Piggyback and makes a request. Mike is on his way out to the store, sees the request, and then accepts it. He goes over to the store, does his usual grocery run, adds a stick of butter to his order, grabs his receipt, and heads back, leaves the butter for Sue, and then they both settle the transaction and confirm the successful receipt of the delivery. Now Sue is really happy because she gets to bake her cake, and Mike is really happy because he got to do a good deed for basically no effort at all. So Sue is able to leave him a good kind of thank you to express her gratitude that she can share with the community. Sue gets to have her butter without leaving the house, and Mike gets to feel great for helping out a neighbor for almost zero effort. Here's our business model. We want to work with residential units that have more than 10 units and charge them a subscription fee. We provide them a sense of community and improve their tenant retention. We're also exploring working with grocers either through an advertising model where their stores are prioritized in the piggyback queue or some other kind of revenue stream, since we increase foot traffic and basket size for them. Our go-to-market strategy is to work with tenant boards and rental managers to generate word of mouth and social content. The competition is like this. Facebook and Nextdoor offer general community forums, which are unstructured and don't give you an ability to help out when you want. Walmart and Instacart are transactional, impersonal, with large delivery sizes and long wait times. The small competitors in this space don't seem to be doing it well enough. We want to provide a use case specific community for deliveries for our neighbors with quick deliveries. We're going to track the weekly active users as well as tenant satisfaction and the number of partners that we sign up. In the last 3 days, we've validated with 21 users and are currently speaking with 2 condo experts to validate our monetization. We'll continue to validate as we go. Here's the team, and thank you so much for your time.
Great job.
Open to questions.
Yes, questions. Okay, judges, if you have a question, please unmute and raise your hand. I see Valerie has one. Go ahead.
I love this. This is great. Question is, how are you going to deal from a usability perspective for those people who are not as acquainted with their smartphones and that kind of stuff?
So many of the seniors that we talked to were fairly mixed in their kind of adoption of technology. We spoke to some that used apps only. We spoke to some that use the web but don't use apps, some that use tablet only. We're aiming to probably do a progressive web app so we don't need to teach them how to use an application and they can use it across desktop and mobile. Many of the seniors we talked to as well got a lot of their tech recommendations from their kids. So that might be an avenue we can go as well.
Thank you.
Bruno, you had your hand up?
Yeah, a quick question. Firstly, I like the presentation. I think it's very valuable to focus on these type of things. I wanted to have a better understanding. You did not talk about the time frame needed to get to market.
So right now we are going to capitalize on the kind of buzz around coronavirus and the fact that everybody is helping out. We don't know how long social distancing is going to last, but we predict in the next 3 months, that's when our biggest push is going to be to drive adoption.
Thank you.
And
Crystal?
I noticed.
Just one quick question. Yeah, Ben, question on the business model. You mentioned a $200 fee for a residential unit. Why taking this approach versus just letting people in the same neighborhood, be it houses or people in different residential units? Why would you want to try to sell something to a vertical unit in this?
So the approach that we wanted to take is to remove money from the eyes of the 2 users that are interacting on the marketplace and find some other way to finance it. The reason for this is we thought about, for example, including donations, but we thought once we introduced money, then it might exclude some people and it might ruin the sense that it's really a fair playing ground for everyone to get what they need based on their needs.
Okay, thanks.
Okay, we've got time for one more question from Paul.
Just really, it's a bit of an extension from Valerie's question. Given that you will have quite a wide demographic in age and capability, how do you envision supporting all your users?
That is a good question. It's not something that I believe anyone on the team has much experience with. But if you like, we could look into it and follow up with you. It is very different, the kind of experiences that we could provide. One thing that we do know is that hopefully there will be a lot of empathy on both sides for the other side of the marketplace. A lot of the people that we talk to would both be a Sue and both be a Mike sometimes. So we hope that they be able to understand when the delivery falls through or if someone on the other end is a bit unreasonable.
Awesome. Thank you.
Thank you.
Okay, so Team Piggyback, you guys can go watch via YouTube Live now. Next up, we have ACO Solutions with Olivier.
And Suresh, I noticed that you had questions too. We didn't get to you, so we'll make sure.
Okay.
Yeah, we'll do our best and kind of pivot around, but I'm sure everyone will have a chance to ask. So. Okay, ACO Solutions, do we have you? If you can just confirm verbally, that would be great. Oh, you're muted.
Hi, yes. Okay, just setting up. All right. Hi, we are about to show you how our video game allows organizations to survive the crisis and avoid being sued by their employees.
Are we supposed to be able to
It's
see your
already
slides?
Oh, you don't.
Can't see, you have to share your screen.
Yeah, I thought I did it, sorry.
Do you know how to get there? You're just at the very bottom. There's a green button in the middle of the Zoom window that says share screen, and then you just have to select your window.
Share.
Perfect.
All right, sweet. Sorry about that.
No worries.
So, hi, we are about to show you how our video games allows organizations to survive the crisis and avoid being sued by their employees. It's already happening. Talk to Walmart executives. The company is being sued because they do not provide masks and clear protocol to follow, and already 2 people died. Some COVID protocols exist to minimize the spread, but how do you know that they are known and applied? It is what our solution is all about. All companies need to set up COVID protocols and ensure that their workers will really understand and apply them. The situation is global and local. Standard COVID-19 protocols exist, but they must be adapted locally and continuous updates. And then to reality of each organization. We bet that covering themselves by sending a memo with a new protocol or to apply will not be enough anymore. The time of passive and generic training related to safety issues is over. Now, we all know that learning a new protocol is boring. It is why we have created a video game to solve this critical issue. The video game is used by the workers to prove that they master the protocol before going out to work. They first review quickly the protocol, and then they must be able to reproduce the sequence and make the right decision when random events occur. Only if they reach the right score, they can go to work. This level of interactivity is why we went the serious gaming way. Since cognitive research suggests that the multi-sensorial experience of video games is amongst the most effective ways to assimilate procedural knowledge, using this training on a daily basis will ensure strong protocol habits in less than a month. And daily and weekly reports based on data collected by the game help the employer assess COVID-19 protocols, understanding, and application. Right now, the priority is to enable groceries and their employees to work within the pandemic world we are in. Then we will enable employees in other industries that will reopen soon. We are starting to focus on the grocery store market in Canada with the following pricing strategy that you can see. With the right partner, we will help all grocery stores with 10 employees or less to weather the storm for free or for a month. And for bigger stores, we can scale our business model and allow easy protocol customization with our web-based tools. We will be able to push to their workers a version with new content in just a few days. Our team is composed of 2 experts in business processes, designers, developers. We have been developing serious games for 3 years now, and we have already included the FDA protocols for the food industry in our MVP, and other industries will follow. Just to remember, our solution ensures that COVID-19 protocols are up and running, and today we are targeting essential businesses such as groceries, but tomorrow we are targeting every other businesses that have frontline employees. Thanks.
Thank you. Very good.
Mary, I'll time the questions if you want to triage.
Okay, will do.
We have one from Sam.
Is that for me?
Sure. Hi there.
Hi.
Oh, okay. Yeah, my question is, you described that you'll be starting off with grocery stores, but once you move on from there to do different industries, how do you plan on approaching that? Will you be the ones that are implementing the game, or how are you going to work with them to make that happen?
Well, the thing is about to understand if there's specific protocols for these business, but I will say like groceries and convenience stores might have the same pretty similar protocols, but let's say a retail for another retail store for garments, and well, they might have slightly different. So the idea is to meet them and maybe meet their association. They might have already some protocols for the retails, and so we're gonna just push our the new content in our game, and it's gonna be simple and quite easy to do it.
Suresh, we
Great,
didn't
thanks.
get you. Thank you. Suresh, we didn't get to you last time. Do you have a question?
No, not for this one. I may have for the next.
Dr. Greenhill has her hand raised.
Thank you.
Hi, Olivier. I really like the idea of a much more engaging format for the employees. I didn't quite understand. You have a gaming console. Is this an app that they download on a smartphone?
Yeah, it's an app. Sorry, it's an app on a mobile. And the idea is before their shift, the employee has to go through the sequence of learning the protocol, and then they get access on this protocol, on this
So for employees
sequence.
who don't have a smartphone, can the employer provide them with a tablet, or how would you handle
Well,
that?
I would say, yeah, that would be the case that the employer will have to provide either a tablet or a phone. But our thought is, well, most of people who's working in that kind of industry will have a mobile phone.
Okay,
But
thank
yeah,
you.
we have to have it.
Questions. Thanks so much.
Thank you.
Next up, we have Pharos.
Hi, just trying to share my screen.
I'll get the timer started.
Sounds good. Olivia, you need to share your screen so that 16 can.
It says I can't share it yet.
Yeah, just hang tight. We'll get that going.
Yeah.
Perfect. Go ahead.
Awesome. Let me know when you can see it, please.
Yes, we can see it.
Thank you. Hi, we're Pharos. We have a problem. There's a rise of domestic abuse cases in Canada due to COVID-19. Currently, there are more than 200,000 victims of domestic abuse, and it costs taxpayers around $7.4 billion to deal with. COVID-19 has doubled this number, but there's been no increase in shelters being offered for the victims. There's a massive market gap as well, and less than 10% of the victims can actually find safe shelter. This is where Pharos comes in. Pharos is a platform that connects domestic abuse victims with available hotels and other accommodations when shelters are full. We went actually to validate the market, and we spoke to some shelters who said they don't have the resources to develop something like this, but they would love to be a part of it. We also asked local hotels to see if they would be interested to help out. And they said they would be thrilled to help out because they want to give back, but they don't know how. So they would love to plug into this platform. This is how the customer journey looks like. The shelter administration has someone come in, a victim who wants to get shelter because they're fleeing an abusive situation, but the shelter is full. So then they go on to Pharos, our platform. And I'm going to walk you through our MVP real quickly. This is what the shelter sees. So they want to register Jane Doe and send her to a nearby hotel. They go in, put their information in there, an ID, register. This is where they see all the hotels that have empty rooms right now. One click, book, bam, the hotel gets a reservation. Very easy, very feasible. We did the MVP in 2 days. This is our business model. Phase one is during COVID, so right now. our payers, this is where we're getting funding, is government, as well as the private sector, such as family, office, trusts, sponsorship, one-off sponsorships, and an important one is the recurring funding partnerships. This will, with hotels. This will feed money into Pharos. We will work with the hospitality industry and eventually help the shelters and the domestic abuse victims. Phase 2 is after post-COVID. That's when we will really focus more on the sponsorship and the recovering funding partnerships. We want to partner with larger hotel chains that have a national presence. And we also want to introduce a subscription-based model offered to the shelters because we believe that Pharos has the ability to revolutionize the industry by reducing shelters' operating and facility costs. We went to look at the competitors and we saw that these are all the competitors in the current space, but no other app is placing actual victims into safe spaces. And that's what differentiates us. No one is actually placing importance into the shelter placements and partnerships with local businesses. Pharos does that. This is our go-to-market strategy. Our phase 1, we will pilot Pharos in Ontario because it has a high amount of such cases. And we will go approach governance and government funding. Then we'll go to phase 2, roll it out with additional features into the rest of the country. This is our team and we'd love to answer questions.
Awesome.
Work. Okay, judges, please raise your hands. Crystal.
Same.
Hi, great job. I'm just curious, are there any additional security measures that would need to be in place with the hotels?
So I will just ask that really quickly. So yes, the fact that we're making Pharos available for pilot to the shelters only means that the shelters can vet it according to their vetting and verification process. So when they send someone over to the hotels, they've already gone through their verification process.
Wendy, oh yeah, Wendy?
Yeah,
I can't hear you.
You're muted, Wendy.
Just building on that, shelters are not just places to stay. They provide all kinds of emotional and other kinds of support to victims. And I think that the security issues can't be minimized. I mean, often, for example, their addresses are not published, nobody can get access to them and so on. So I wonder if you can just walk us through your consultation with shelters and how they suggested you would address some of those issues.
Andrea, would you like to take that? I'm just going to defer to any of my other team member. Andrea?
Yes, of course. So basically, what we're planning on doing is that we're making use of all of the different protocols that the shelters already use. So they are in charge of getting a lot of different information to make sure that the client is safe and passing this information into the portal, which is going to have very strict IT standards that vets it from a privacy standard. More so whenever we're like the phase 2 of this project is to ensure that we have more features included in the product. So we're going to have a co-creation stage where we work with the shelters to understand what they're lacking right now and what they can offer better. And when we create a subscription model, we're going to make sure that we include the different tools that shelters need to use and that they're willing to pay money for, so that that can be included in the subscription-based model that we're going to be offering.
Awesome, thanks so much. That's it for questions. Okay, so next up, if you can stop, you've already stopped presenting. We just have Rest Assured with Kelsey.
Hi there, everybody. Just seeing if you can hear me.
Good to go.
Awesome. And Michaela as well. We do have a second speaker.
He's just muted.
Okay. I think, Michaela, you're muted there.
So I'm going to start the timer.
Hello now.
You're good now, Michaela.
I'm good now. Shared screen up, which I've seen and I don't see anymore.
Yeah, your presentation is down. You'll just need to reshare.
Okay. We have Juan sharing there. Just give us a second. It was just up. There we go.
Perfect.
And before you start, Kelsey, I'm running the timer. If
okay.
That's helpful to you, okay?
Absolutely. Thank you so much.
Okay, you can start.
Okay. Michaela, I think you're still muted.
Oh,
Yeah.
yes. Am I muted now?
No, you're good.
Okay. Okay, so I'll start. How many of you have ever had a loved one admitted into a healthcare facility and are wondering about the healthcare that they are receiving? This is a problem. Communication between nurses and patient family members has always been an issue and is even more of an issue with COVID-19, given the shortage of nurses and high volume of patients. The process for updating family members is extremely manual and time consuming. A nurse has to grab a patient's chart and read off the updates to the family member, which results in hours of nurses' time being taken away from direct patient care. We validated these pain points with over 100 research participants, and we estimated that for a small regional hospital alone, nurses are spending about $10 million worth of time on the phone with patients' relatives per year. With this much being spent, family members still aren't getting the updates that they need for their loved ones. Our solution is a web page and mobile application where users can easily access updates about admitted loved ones. This will allow for reduced workload for nurses and direct time back into patient care. Rest Assured will provide easy to use digital solution to enable healthcare workers to communicate real-time wellness information about patients to their relatives who can view the information on demand.
Our mobile app was developed on Ionic with security and ease of access at the development core, identifying patients by codes rather than by their names to further protect their privacy. This code would only be known by the patient's primary caregiver and the family or of the patient. Our caregiver portal was developed using Django to provide the best security parameters for a healthcare-based application. This portal will allow caregivers to manage, update, and post updates of their patients in one spot. Rest Assured's primary source of revenue will be a monthly subscription fee of $2.99 charged to the healthcare institutions on a per bed basis with basic and premium subscriptions at differentiated pricing. Assuming 10% adoption by hospitals and 40% adoption by long-term care facilities, we anticipate potential annual revenue at $3.7 million. A secondary source of revenue that we can explore post-launch is the ability to surface relevant advertising for end users. We will launch a pilot phase for a handful of innovative healthcare institutions. We will then iterate on the most important features so that we can launch across Canada with our best foot forward. Our team found that while some companies offer similar technology, ours is truly one of a kind. From our summary chart, you can see that our unique target industry, combined with major cost savings and seamless integration, highlights our advantage among potential competitors. Take a look at our live prototype demo of the web application. Here is our team, and we hope we have highlighted to you today why this is a problem, will always be a problem until there is a solution. Thank you.
Thank you.
Awesome.
Thank you so much.
From the judges? Please raise your big vote. We have Suresh.
Hi, how are you?
Hi, as a healthcare worker, I can fully relate to this problem. This is a real issue currently, as visitors are not allowed inside the hospitals or long-term care facilities. My question is, have you thought about integrating your app with the hospital information system?
Absolutely, and that's the target that we're actually going for. We're really, as RNs, me and Michaela, we see it from both sides. We've been in the healthcare industry, we've been in all units doing our degree, and we feel like the EMR would be the easiest integration, so we can just get that information pulled and implemented right into the app right as soon as the nurses update it and document.
Okay.
Absolutely.
Second connected question is, have you thought of charging the fee from the loved ones rather than the hospital? Because
We did.
that's easier attraction.
Absolutely. We did think about that too. And the reason why we're still a little bit touchy on that is because of our free healthcare in Canada. I just feel like it's in everybody's minds that healthcare should be free. So everything surrounding it really should be free. And it's a free service to call the nurse's desk at any time you want. So it's kind of hard to pitch charging them for that.
Thank you.
You're very welcome.
Sunil, you had a question?
Yeah, well done. I thought that was a really great presentation, and you really covered things like your business model. When you were presenting, I was thinking of some of the companies that are attacking the aging at home space, like kind of like in the business like Suresh, who was just asking that question.
Yep.
Companies like Maven Care that are, and what they're doing is they're tech enabling the home. So they're allowing the next of kin, usually the children of elderly people, to interact with their loved ones using video and using chat, helping with selecting meals and ordering food. Are you thinking about that in the context of a healthcare environment, and how you're going to tech enable the bedrooms that these people are in?
Absolutely. I think that can be, I think our timer's up. Unfortunately, I would love to connect with you after. I would absolutely be able to answer your question. Thank you so much.
If you want to give a 1-sentence answer, I think that's allowed. 1 sentence.
Yep. So I believe that as like a premium model is going to come into place, things like that will be put into place where a video conference can be delivered, meals and things that maybe a patient would request from their family members could be implemented. That is absolutely something that we thought about for our premium model.
Thank you, Kelsey.
Thank you so much.
Okay, so next up we have safe return to work.
Hi, everyone.
Hello.
I'm just trying to share my screen. Let me know if you can see it.
Not yet, but we'll wait, let you know.
Thank you.
Oh, and just a reminder, once you're finished your pitch, please, the one who's pitching and your team, if you can please leave the Zoom room, but please go ahead and continue to watch the rest of the stream via YouTube Live.
Can you guys see my screen?
Not yet.
This.
Do you need a hand? We can just give you instructions. If you just go share screen and then you have to select the window and then hit share to that window.
Yeah, I'm hitting it. You guys see it?
Not yet.
Danielle, this could be the screen.
Is it coming up?
I think your video's off.
Not yet. Is there anyone else in the room that can share their screen for you while you pitch?
No, we're all in different locations, unfortunately.
Okay, maybe we can make an exception and just take a pass on you while you sort out the technology issues.
About that.
Do a refresh. We'll move on to the next team for now and come back to you.
Okay, thanks guys. Sorry about that.
So the next team is the Great Quarantine Bake Off. Let me know if you're able to see our screen.
Yep.
Thank you.
Okay.
And just before you start, I'm going to be running pitch timer. So just to let you know. So you can start.
Okay. 3, 2, 1.
We are the Great Virtual Quarantine Bake Off. Let's face it, with COVID-19, there'll be social distancing for the next 8 to 10 months. The stay-at-home initiatives comes isolation and loneliness. We're stockpiling on food like crazy. We don't know what to do with it. There's 1.14 million people unemployed in the food and beverage industry. There's only so much Kings and Tigers and cooking shows we can watch. All 99,000 of them in the last 6 weeks. Now what?
We all want good food, and there isn't. Get that right. We want everyone to be self-dependent and make their own delicious dishes. This platform is an amazing opportunity for that. We're a global community. With that in mind, every single session we want to mix it up so we have different ethnic dishes. So not only can we celebrate diversity, but we can also learn while having a great time. Now, how does it work? Order your 5 ingredients from the food delivery service. Compete with 5 different people on live stream with a professional chef on the side overwatching the whole event. Win grocery points while having feedback from the chef so you can become a better chef in the future.
At the Great Quarantine Bake Off, we are bringing together the world for a friendly cooking competition. Now families have time to connect over a great meal, as well as meet new friends. Our early adopters are people already registered with meal kit companies. 1/3 of them are 25 to 34 years old. We're targeting team company events and kids cooking classes. We're planning to partner with local meal kit companies and chefs who are recently laid off. Revenue in the food delivery service amounts to 2,000 million in 2020. We're estimating 1% of that revenue. So far, we have about 20 responses, majority is very positive. One person said, "Sounds fun, and if goals are achieved, there's a great sense of accomplishment." Let's jump right into the demo. After logging in, you can just choose your local chef based on their work and your dietary preferences and needs. Schedule a delivery for both the bake-off and groceries, then start the bake-off. 45 minutes later, you receive your score as well as feedback and grocery points. It's just as simple as that. Let's wrap up the final icing. We have an opportunity to gain revenue via ads, partnering with local and global food brands and chefs, building consumer loyalty and engagement. With current market trends of highest viewership online for cooking shows, panic buying baking goods, grave food service unemployment rates, and negative mental health effects, we're allowing everyone to bake their cake of happiness and eat it too. Thank you so much.
Awesome, thank you. Balaji, I know you've been trying to jump in. Did you have a question?
I guess the immediate question I have with respect to this presentation is, how does the scoring actually work?
So for the scoring, how it works, obviously you can't eat the dish virtually. So again, it just be based off of creativity, as well as the texture, the looks of it, and as well with the judges, with the chef's response as well from what they can see, they'd be able to give a score that way.
I understand.
Awesome. Next question.
Dr. Greenhill?
I love the idea of bringing together people because you're right, mental health right now is suffering. Why baking in particular, and why not the greatest cook-off? Because you want to be inclusive of all type of capabilities.
I think our main focus was baking because we found some research along how baking itself had positive correlation towards mental health. Since there was such a massive sensory and feeling and taxable and tangible feeling while cooking, it is also releases a lot of smell and sense and brings back nostalgia and family memories, which I think a lot of people will be a lot more happier to kind of take on. That was most of our research, and that's why our focus was the baking, as well as the Great British Bake Off and the Great Canadian Bake Off have massive viewerships. Yeah.
Awesome. Rena, you have a question?
Yeah, I also thought it was a pretty interesting concept, especially sort of gamifying the traditional meal kits that people might be used to. I had a question, really basic. You call your venture the Great Quarantine Bake Off. What happens after quarantine or social isolation or physical distancing ends? Like, have you thought whether or not this is a maybe some rebranding would be necessary? And it's a bit of a nod to Dr. Greenhill's question to broaden your scope of marketability by having it the Great Cook-Off.
I think we could definitely look into rebranding if that's something in play. But if you can see up there, it was virtual quarantine bake off. That was our main focus, as well as getting like a global audience and a global playing field. So we would still have a massive market that we would still use.
Also, just adding to Lean's point too.
we're out of time.
Yeah,
sorry.
we're out of time. Sorry about that. Thank you very much.
Tracy, are you back from Safe Return to Work? Maybe we can give it another
go. Let me give it another try, and I apologize. My team members are trying, but they're not on PCs, they're on phones. So it's presenting a bit of a challenge, but let me give it another go here.
Okay, backup plan will be that we can play your pitch video.
Yep, fair enough. Yep. So sorry about that. And just let me know, do you see it?
Not yet. Team, are we able to possibly queue up this video? If you need me to come back, just let me know.
Which one is it?
This is for Safe Return to Work Blueprint Creator.
everyone, and thank you for allowing me to.
Is everything to work?
Hey, Tracy, we're just going to queue up your video.
Okay.
Sorry about
Shall I go ahead? Danielle, shall I go?
Yeah, please go ahead.
Hello, everyone, and thank you for allowing me.
Why you just need to share your screen?
To show you our back to work, safe at home,
Did it
safe
work?
at work, unique
No, we
solution.
still can't see you either.
What's our problem? Well, we have over 1 million small businesses in Canada.
Oh, okay,
Inclusion,
we can see now.
business, safe at home, safe at work, unique solution to combating COVID-19. What's our problem? Well, we have over 1 million small businesses in Canada today. Now, many have been required to stay open as they're an essential service, but what about the ones that have had to shut the doors? We reached out by social media and asked, have you thought of a safe return to work process, or would you be interested in receiving products or services when we can start thinking about the time to reopen those doors? Over 90% replied, yes, they would. Now, our detailed business model from a value proposition is very strong. There's an immediate need for risk reduction. We're talking about life and death. So what's our solution? The Return to Work platform. Now on this platform, we have various revenue opportunity. We can immediately resell online safety courses to businesses, regardless of what industry they're in, offer online webinars, consultation services, and ultimately partner with industry experts in building our very own Safe Return to Work online course. We have over 1 million small businesses. So if we were able to create this course and put it on multiple platforms, we could earn upwards to $33 every time that course sold. This opportunity makes sense. So initial costs, we would have a reseller one-time setup fee, website and app costs, marketing and legal, and again, that Safe Return to Work course costs to get that going. Our minimal viable product would be the website that we would be hosting everything on. So this would include checklists that our customers would be able to download. It would include that consultation service option, online webinars, all of those safety related courses applicable in any industry. And again, as we work toward creating our own online Safe Return to Work course. The company that we're partnering with is a Canadian company that has upwards to 1,500 safety related courses. Our marketing strategies are partnering with strategic partnerships, and our competition, although they would be a partner, BIS Training Solutions would also be a competitor as they have their own website and online store. JJ Keller is a US company that produces courses themselves, but the ones that we want to directly tackle, the competitors that we're really wanting to address are those downloadable resources that do not meet our high Canadian safety standards that right now small businesses are referring to open their doors far too soon. Here's the team that came up with these strategies. And in conclusion, small businesses are the root of who we are. Please consider investing in them and in us. Thank you.
Awesome. That was a great video. I'm sorry you weren't able to do it live. Questions from the judges? Thiesel? You just need to unmute.
Hi, it's Felzo from Vancouver. My question has to do with the different customer sets. Could you differentiate the different, because the different customer segments, because I think a grocery store would be different than a factory, which would be different from a taxi cab. I didn't see that.
Yeah, that's fair. Thank you for the question. So the online safety related courses that we would have access to selling as a reseller actually are not industry specific. So courses like safety in the workplace, sexual harassment, WMIS is a common one that most industries use. There's some very common ones that are actually applicable regardless of industry. The one that we really want to tackle and create ourselves is that Safe Return to Work customized program, the course that we create ourselves, that then we can just blanket out regardless, that people would have to refer to. That's the passion behind our startup.
Awesome. Next question. Did we have one from John? No. Okay.
I think I saw one from Suresh.
Hi, I'll actually build on to the question just asked. There is a very urgent need as a health service provider. I am looking for those courses. We had to develop something for our own employees immediately. But I can tell you this weekend or next week, there are people looking for specific industry-related courses in this area. And a customized course is required, not a standard course, because the requirements are very customized.
Right. Do I have time to answer the question? I can see I'm ticking away.
Yep, just wrap it up quick. That would be great.
Okay. So we do have up to 1,500 customized courses that are applicable in the safety. So the common denominator would be safety. And then the one that we're wanting to create, we absolutely put some dedicated time to it. We didn't think it would be created overnight. And we would be working with industry experts to execute that. But there is upwards to 1,500 safety related courses that we would have access to, applicable all industries.
Awesome. Thanks so much.
Thank you.
Thanks, Teresa.
Next up, we have UVC spray bot, Mazik.
And we want to remind the team after you finish presenting to please leave the room, and you can view it on YouTube Live. Thank you.
Hi, I'm Vladimir from Spraybot. I'll be presenting, talking, and Alex will be showing the presentation. Is everybody able to hear me and see the presentation?
Yes, we can.
Awesome, cool. So we will start. Alex, 1, 2, 3, let's go. Hi, my name is Vladimir from Spraybot. COVID-19 has impacted all of our lives. It is a highly contagious virus that can easily be spread from person to person and can live on objects from a few hours to a few days. People in contact with the virus have a high risk of catching it themselves or spreading it. Wearing protective gear helps, but for situations that are not crucial, this equipment can be used by first responders. Spraybot is our solution to cleaning and sanitizing public areas. It emits UVC light as well as sprays as disinfectant to make sure that 100% of harmful bacteria and COVID-19 is eliminated without using specialized rubber or scarce PPE. Our target customers are public transit, government buildings, offices, and warehouses where specialized cleaning crews are not available or are too expensive to hire. A few potential customers that we spoke to include the Longueuil Public Transport Network that would like to use it for their bus and metro stations, and Rheinmetall Defense Canada, who would like to use it for the warehouse where currently people are working. In addition to these clients, we intend to target large supermarkets, schools, and businesses where there is a high traffic of people. The majority of customers we talk to express their concern with their current sanitization protocols and have pain points with obtaining cleaning supplies. They also express interest in more sanitization and disinfected methods. Our current competitors are standard cleaning crews that can be expensive, as well as less versatile robots with single sanitization methods that are outrageously priced. Spraybot shines a UVC light that eliminates COVID-19 and other harmful viruses and bacteria that can be harmful for humans. In addition, it sprays a disinfectant that is not harmful to humans, but will eliminate COVID-19 and other harmful elements. It is fully autonomous, and here is a real demonstration that Spraybot is used to move around using AI. It can deploy itself automatically or using a set schedule or being deployed manually by sending a command through a command platform. We obviously consider the safety of the people the most important. All the methods of sanitization that we are deploying on the Spraybot have already been proving to work in eliminating COVID-19, all the while being safe to humans. Manufacturing will be outsourced to contract manufacturers until we are able to manufacture in-house. Since COVID-19 is a current threat, manufacturing might take some time, but because of this, we are licensing our product to other companies that are able and willing to manufacture the Spraybot or pieces for it. In early steps, we will be licensing the design and pieces of Spraybot to companies that can help in manufacturing it. Once we build it, we will have exponential growth since we will offer renting Spraybot to customers. We will rent it so that companies do not have to pay the upfront costs of the robot. We project to have revenues in the first year since we will be licensing the design and parts of Spraybot to businesses that will allow help fund the manufacturing of Spraybot. Our team consists of health specialists, engineers, and marketing and business professionals that will ensure that Spraybot is built fast, reliable, and so that people know it exists. Spraybot is the solution to keep our public places safe and so that we can continue living our lives as if COVID-19 never happened. Thank you very much.
Awesome. Thank you. We have a question from Sandra.
Oh, hi there. Can you hear me?
Yep. Yeah. Hi,
okay, good. Hi. I was wondering what chemicals would be lethal to a virus and perfectly safe for humans.
I will let Ling C please answer this question. Ling C, are you on the mic?
Hi, yes, this is Lindsay. In terms of the disinfectant that's approved for use, there is a list that's approved from Health Canada that's been demonstrated safe for use for COVID-19 and can be used in the presence of people.
Okay. Can I just follow on? Would you not have to get, or have you factored in getting approval to use these chemicals in this manner? I'm just wondering about the timing for getting something like this off the ground and the kind of health approvals that would be needed. Did you have a chance to look at that?
We did not. No, I mean, we have that list that we were looking over, but in terms of ensuring and going through the testing side of things, we recognize that that's going to be something that is kind of factored into the production time to make sure that we are up and running and using products that are safe, of course, for a sanitary environment. We're being careful to avoid produce, for example. Something like that would be a little bit more complicated, but we're just focusing on things that would be okay for getting approval, everything.
Awesome. We have a question from John S.
Yeah, so it's an important problem, and in fact, there are a number of solutions that you did identify one or two. There are robots right now that do both UV and do spray disinfection. They are expensive, but that's often the reason that they're dealing with a large number of infectious agents. So two things. One is, can you comment on why you think you're going to be less cost? And the regulatory side is part of that. And the second is, are you going to transition from doing COVID to doing general disinfection later on? Because COVID will be a very short term, I think, like in the matter of a year or 2 years. It's not going to go on for 20 years. Can you comment, please?
Yes, indeed. Well, taking the second part of your question first, I think you're absolutely right. I think people are going to be we're seeing a big shift in how people are operating now. Like, I think it's going to be very top of mind for businesses, public transit. Everybody's going to be very conscious of this from now on. So yeah, COVID-19 is the problem of the day today. Who knows what we're going to be dealing with, in years to come. But I think that shift in people's brain is going to be enough for organizations, whether they be government or, large organizations who are going to be wanting to do this on a regular basis anyway. So I don't, our vision is that that's not going to be a problem. Sorry, with respect to your first, can anyone else comment on the first?
Actually, we're at time, so just one sentence to address the first question, Alex, if you don't mind.
Anyone else?
Okay, sorry guys, we can maybe wrap that up. Thank you.
Thank you.
Okay, next up we have 16-bit Cortex.
All right, hello. Am I sharing now?
Not quite, but we'll let you know.
Now I should be sharing. Can you all see?
Yep.
Wonderful. All right.
And I'm going to be running pitch timer. Hopefully you can see it and it's helpful.
Okay. All right. So my name is Tom McKinney, and as a millennial, I join more than 1 in 2 people in my age bracket who experience mental health challenges over the course of my life. Unfortunately, current approaches to delivering clinical services for mental health are based on antiquated technology that cannot scale to meet this increasing demand. I entered my PhD in neuroscience to explore the role of technology in addressing these inefficiencies and improve mental health assessment. My research led me to develop a new testing approach, which could be gamified to improve treatment adherence for individuals, streamline assessment protocols for practitioners, and in the workplace, this would lead to reduced absenteeism due to the extreme costs associated with leaves of mental health absence. And just in general, this would improve overall quality of life for people. The key innovation for our approach is the gamification of the psychological assessments, which are typically boring, long, and tedious. And instead, we want to make them fun and engaging. And by automating this, we are enabling clinicians to be able to spend more time actually working with their patients, treating their problems. To do good for the community, we want to offer a limited free version for all individuals. And then our main revenue streams will be through subscription-based analytic services, that we can deliver to private practice agencies, as well as corporate wellness initiatives. As a published scientist and content expert in mental health, my expertise and speaking at conferences as well as media coverage lend credibility to this platform. And our team over the next while will be looking for strategic partnerships with various universities, professional associations, and other nonprofits. Our main competition is the various mental health therapy apps available out there. However, they almost all lack an integrated assessment component, which is a major shortcoming of their business model. And while there are some online cognitive assessment tools available, they're developed for research purposes, so their user experience leaves quite a bit to be desired. I'm joined with a wide array of talent, ranging from mathematicians to MBAs to other neuroscientists and analysts, in order to bring our vision to reality. While mental health was an issue before COVID-19, this pandemic has seen an explosion in concerns, and recent data from Canada now suggests that more than half of Canadians are actively concerned about their mental health. We believe that this will lead towards a large market share of approximately 11 billion for telemedicine by 2023, and COVID is only expected to amplify that to be even larger. On our launch website, you can find a demo of the new assessment approach that I developed, and our team is actively looking for new clinical partners in order to empower people with mental health challenges to take back their life. And I think I'm out of time now, so wonderful.
Okay.
And on that note, I'll take questions.
Yes. Wendy?
Yeah, thanks very much. I think it's an interesting application. I was curious, though, about your assessment of the marketplace, because I think you identified a number of very specific tools, but could you maybe comment about the current state of digital health programming at Canadian institutions and what you see as some of the potential issues in terms of breaking into those value chains? So I'm thinking of some of the very big service providers, for example, that are providing online mental health applications. Can you talk a little bit about the structure of the market and how you would break in?
Yeah, so basically a fundamental approach of our platform is that you actually need people to be doing these mental health assessments for clinicians to use them. And most current approaches to assessing mental health, as I mentioned, are very tedious and boring. And those are the ones that would likely be marketed by the different agencies that you mentioned. So kind of our key innovation is being able to do that. And additional, through our microgame format, we're able to actually cover a much more comprehensive picture of people's mental health, getting more detail in between therapy appointments.
Awesome. Next question, Dilzil.
Hi, Thelzo here from Vancouver. With mental health, it's always a challenge to have in person to get compliance, and then there's patient confidentiality issues. Could you address that in the digital format, how you would ensure compliance and how you address patient confidentiality? I know they're two separate subjects, but related.
Well, so as patient confidentiality, we would have to make sure that our platform was HIPAA secure. That's kind of the gold standard as far as all clinical services at the moment for making sure that it's got proper encryption. And then as far as the compliance, that's why we're making them fun and engaging so that people actually kind of want to give their clinicians the data for their mental health, as opposed to filling out hours of forms.
Okay, yeah,
I think
go
we're out
ahead.
of time. We're out of time for questions. Thank you.
All right, well, thank you very much for this opportunity.
Awesome.
Okay, next we have Team Foodie.
Hello. Hi, everyone. So can everyone see the screen?
Yes, we can.
Awesome. Okay, perfect. So hi, everyone. We are, wait, do we have the timer?
Yes.
Yes.
I'll start now.
Okay, hi everyone. We are Foodie, and I'm going to start off by telling you a little story. So, meet Alberto. He is a low-income senior living in Toronto who is housebound and can't go outside due to COVID. Meet Marcos. Marcos is a small business owner and he is experiencing a reduction of sales due to COVID-19. So the problem that we are seeing and the opportunity at the same time is that there's excess food from local restaurants that are going into the garbage at the end of the day. And then we have low income seniors who are in need of economical food options. So this is where Foodie comes in. We are trying to feed low-income seniors using this excess food from restaurants. So we're looking at affordability, we're looking at providing restaurants with another income stream, reducing pressure on the supply chain, as well as decreasing food waste. Next. So our business model is that our clients are qualified through social workers. They have to be low income, obviously. So the social worker will create a profile for them on our system with their preferences, match them to the restaurants that are donating to our service, and our volunteers will go and pick up the food and then obviously distribute it. The meals are paid for, and it's paid for via subscription at the beginning of every week. Next. So our main competitor right now is Meals on Wheels. Having spoken to social workers and the West Neighborhood House, which is a social service, they are finding that a lot of their low-income seniors don't have a lot of options when it comes to, alternatives to Meals on Wheels. There's a very European-centric menu with Meals on Wheels, and these clients all have varying, diverse backgrounds. Next. Sorry, this is just a mock-up of our slides of the app that we are hoping to have on the restaurant side and on the customer pickup side. And now we're going to go to the market.
So to our go-to-market strategy, we want it to be laser focused, and we plan to launch this as of next month. So we're going to be focusing on Ward 10 in the GTA, and obviously on seniors who qualify for this specific support. We're going to be working with local restaurants that are culinarily diverse, and then we're going to be working on a neighborhood that's very close to the West Neighborhood House that we spoke about. And the way that it would work is between 7:30 and 9:30 every day, orders would be matched between seniors and restaurants. Foodie employees would go to pick up these packages, and then they would use Uber to make deliveries, and they would make 3 deliveries per Uber ride. And then once they've made those deliveries, they would be matched with a new set of orders. The beauty of this entire pilot program is it's very scalable, and we've constrained our neighborhood to a 2-kilometer radius. So it's really about getting up and running pretty quickly and realizing what obstacles we have and then tweaking them as we go. So over to Crystal.
I think we're done with time.
Oh, yeah, we're out of time.
Okay,
yeah, that's our financial projections.
So before we take questions from the judges, this is our second last round, so I want to make sure I catch judges who have not had a chance to ask a question if they would like to. So please, if you haven't asked a question yet and would like to, can you raise your hand before we start? Okay, if there's no judges who haven't had a chance, anyone will open it up. Please raise your hand for a question.
Durandra, do you have your hand up? No?
I'm fine with this.
Okay, we've got John.
Yeah, I really like this. I really like this, particularly using the waste. I loved it because it's such a big problem. But are you worried that having employees in your company didn't quite make sense to me, as opposed to creating something that just happens and yours is a platform for doing so? So for example, Uber drivers could just make more money by being your agents and just going directly to and in fact, Uber couldn't wipe you out of the market if they saw the idea. So can you comment on that?
Exactly. So we decided to start the pilot program in Ward 10 just using what we call our staff, or just the people who created it, as a test to see what would work. The slide that you didn't get a chance to see was where we had to do further validation with companies like Skip the Dishes and Uber to see what the cost structures would be involved with trying to get them on board to leverage their network to help us with the distribution of the meal Wheels. So it is something that we are looking forward, we are looking for in the future. It's just a matter of the validation process that needs to happen for that.
Thanks. And Sandra?
Hi, I was wondering if you looked at, I didn't see Second Harvest up there, but Second Harvest has a massive network of food rescue and food delivery to definitely across the GTA, and then I think they're in a couple other cities, but they're massive in Toronto. Did you look at them? Because I didn't see them up there.
No, we did look at them to do and then actually I think you might be better suited for this question.
Yeah, so we specifically wanted to focus on Meals on Wheels because when we were doing our validation, we want it to be a lot of social workers would talk about Meals on Wheels and the pain points that a lot of their customers had specific to that particular service. So we wanted to be a service that was an alternative to Meals on Wheels, but I definitely think that looking into Second Harvest would be a great idea to kind of like learn more about our product and how we could evolve it.
Yeah, given
Thank
the 2
you.
days, there was very limited, things that we could really explore.
Of course, yeah. Thanks.
Thank
Okay,
you.
thank you.
That's fine.
Vic, we know you had a question, so we'll call you first for this next one.
No problem.
Thanks. Okay, so we have HealthBot last but not least.
Hi, is Sean on here?
Yeah,
Yeah, perfect. So he's going to start.
yeah. I just need to share my screen, but give me a sec. Cool. So hey everyone, I'm gonna talk about HealthBot. Oh, sorry, just have to wait for the timer, right?
Yeah. So I'm ready when you are.
Cool. Thanks a lot again, everyone. And HealthBot is a virtual assistant for travel assurance and safety. So I'm sure you're all aware that there's a huge problem right now with the travel industry. It has significantly been impacted due to the COVID-19 crisis. Air Canada just laid off about 5,000 employees. And a lot of the reason for travelers not booking flights or traveling is because there's a lot of misinformation, mostly travel restriction, as well as safety concerns and protocols. So that actually equates to a 314 billion US dollars at the end of Q2 this year in terms of projected revenue loss globally for airlines. And not only does airlines get affected, third-party booking platforms, travel agent, as well as travelers also do get impacted as well. So our solution to that is we build an AI-powered virtual assistant providing accurate, accessible, up-to-date information regarding pandemic and general health and safety developments of the targeted destination. So if you look at our app here, we actually built a prototype that's readily deployable, informing travelers and encouraging them to actively plan for future travels depending on the risk factor percentage and current government regulation and restrictions. So how does it work? For travelers, travelers can be notified of a destination safety level prior to booking. After booking, they will actually be notified of any changes in regards to safety, local government restriction, and other relevant travel restrictions and things that are set up in place. For a lot of third-party booking platforms and airlines, they can set up alerts for specific travel dates to selected countries for pandemic and restriction updates. So how big is the market? So we're looking at 164 billion. This number seems very large, but our obtainable market is $8 billion, and this is revenue through booking platforms and travel agent, which is our lowest hanging fruit in terms of channel partners. And our go-to-market strategy would be we're targeting frequent flyers, people traveling for work and conferences, and immigrants. And we're doing it through Facebook ads, targeted online campaigns, and also affiliate programs with travel agency, third-party booking platforms. And our business model is free to use for passengers and travelers. And for agency and airlines, we will charge a transactional fee of 2% upon booking. So our competition, we have a pretty stacked competition. Most of the reporting or risk management, they're very archaic to use, like international SOS. Citata would be the one that is closest to us in terms of providing content and intuitivity. But we actually act more as a virtual assistant, guiding and giving recommendations to travelers. So our team right now, myself, I have over 8 years in sales and business development. We have Nino for product management, Melanie for UX research and design, and also Khalid for research, data analytics, and Dan for business development as well. So we conducted about 29 surveys and validated 2 important hypotheses, and we put together a prototype and landing page. And our ask right now is we're looking for partnership with existing platforms and giving travelers a peace of mind. Thank you.
Awesome.
Yeah, I'll give the questions Q&A back to Nino.
And Vic, did you have a question? Sorry, I wanted to jump to you Vic or...
Thank you, Danielle. So how would you compete with airlines who have their own apps who can assimilate and deliver this information to travelers through their own dedicated apps?
So the way we envision this is that we help airlines by gathering information from various organizations worldwide. So we will be doing the heavy lifting for them rather than them having to compile all of these reports. We will be manually scraping this data, or we'll be automatically scraping this data from World Health Organization, YADA, and such relevant ones, and we'll be delivering them to them so that this is less overhead for the airlines and they can just use our service to encourage their customers to travel without having to do the extra legwork.
Thanks. And Sergio, do you have a question still?
Yes, so I found this fantastic. I'm someone who's traveling every year thousands of miles for work and for pleasure. And it happened to me very times that I was stuck in Brazil because I just didn't have yellow fever and then I had to go to the hospital, to the clinic. So this is awesome. Have you thought, because this is more B2C, have you thought of doing something like a B2B2C, so corporations or organizations, not for profits, can offer that to those employees? I think that would be massive.
Yeah, absolutely. So we envisioned this partnership with the airlines and the travel agencies and flight aggregators as in terms of like our revenue streams. And we're planning to start off with the consumer market, but we would gladly implement a separate, more customized solution for corporations as well, because we think it's very relevant information, especially for people booking business trips before they are going to start traveling, because they need to get back on the road.
So if you launch it and you want B2B partners, ping me.
I will actually. This ties in with what I'm working on, so I will absolutely.
Awesome. Okay, one more question. John M. Did you still have a question?
Hi. Have you looked at the travel insurance industry as possibly one of the sources for paying?
Excuse me, I can't hear you really well for some reason.
Can you that any better?
Yeah, much better.
Okay, so I'm wondering if you've looked at the travel industry, travel insurance industry. And have you also, there's a company in Toronto called Blue Dot, and you might want to look at them as well.
We haven't done as much research into travel industry, unfortunately, due to the lack of time, but I will look into that company as well and see. But they, if they're a direct competitor or anything like that, we will do our research and see how we can differentiate for sure.
Okay, thanks so much.
Cool, thanks guys.
Stop sharing your screen. I'll just share our last slide here and let Mary unmute herself here as well. So first of all, I'd say let's give yourselves a huge round of applause on the Zooms.
Yes, great job. Excellent job.
Okay, can you see my screen there, Mary?
Oh, yes. Thank you. So thank you, everyone. We invite everyone to join us again at
well, we're a little over time, so
we're over time. I'm looking at the time. So it's supposed to be 6 p.m. Eastern Standard Time for our YouTube Live for the announcement of final 3 teams. We know the judges are under really quick turnaround, so we're going to let the judges go and convene and pick our top 3 teams. But again, a huge congratulations to all 10 teams pitching, and we'll see everybody again on the second YouTube Live. We have a bit.ly link, and it's bit.ly and then all caps startup weekend swcan.closing. And we invite you to our closing ceremonies. Anything else, Danielle, that we want to remind people?
Yeah, just that the judges are going to get to work. So if you're on a team, please exit the Zoom call right away so we can get going, and then we'll take it over from here.
Yeah, and put the link in Discord, judges panel, Danielle.
Sure.
Yeah.
Or can you just give us the 2 steps we're supposed to go through? Are we supposed to get off this call and join a different one?
Yeah, I'll just spend a couple of minutes with you.
On this call or somewhere else?
On this call.
Yeah, so
Okay.
basically you'll stay here on the Zoom call to deliberate, and then the presentations will be happening via this YouTube link I'm about to share.